There is one small fruit that many people walk past in the supermarket without giving it a second look. It is not expensive in most places. It does not need to be cooked. You can eat it with breakfast, add it to a salad, or enjoy it as a simple snack. Inside that small fruit are nutrients that take part in protecting cells, supporting healthy blood vessels, and maintaining tissues throughout the body, including the eyes. The fruit is kiwi fruit, usually called kiwi. Now, I want to be clear from the beginning. Kiwi is not a cure for cataracts, glaucoma, macular degeneration, or blurry vision. No single fruit can restore lost sight or replace an eye examination. But kiwi can be a useful part of a balanced eating pattern that supports your general health and gives your body nutrients connected with normal eye function. This matters more as we get older. After the age of 60, the risk of several eye conditions begins to rise. Some changes happen slowly and may not cause symptoms at first. That is why healthy food is only one part of protecting your sight. Regular eye examinations, good blood sugar control, healthy blood pressure, exercise, sunglasses, and avoiding smoking are also important. In this video, I will explain what makes kiwi interesting, how its nutrients may support your eyes, the easiest ways to eat it, and who should be careful with it. Stay until the end, because I will also give you a simple eye health plate that is more powerful than depending on one fruit alone. I am Dr. Adrian Mercer. This video is for general education and does not replace personal medical advice from your own healthcare professional or eye doctor. Let us begin with the part of your eye that helps you see fine detail. At the back of the eye is a thin layer of tissue called the retina. The retina receives light and changes it into signals that travel to the brain. Near the center of the retina is a small area called the macula. The macula helps you read, recognize faces, drive, and see details directly in front of you. Two natural pigments, called lutein and zeaxanthin, are found in the macula. They belong to a family of nutrients called carotenoids. These pigments help form what is sometimes described as the eye's internal filter. They absorb some high-energy light and also act as antioxidants. Antioxidants help the body manage unstable molecules that can damage cells. Your eyes are exposed to light every day and use a great deal of oxygen, so protecting eye tissues from unnecessary damage is important. Kiwi contains small amounts of lutein and zeaxanthin. It is not the richest source. Dark green vegetables such as spinach, kale, and collard greens usually provide much more. But kiwi gives you these carotenoids together with a large amount of vitamin C and other useful plant compounds in a convenient whole fruit. That combination is what makes kiwi worth discussing. The first reason kiwi can fit into an eye-friendly diet is vitamin C. Vitamin C is an antioxidant that the body cannot make on its own. You must get it from food or supplements. Fruits and vegetables are the main food sources. The tissues and fluids in the eye contain vitamin C. This vitamin also helps the body make collagen. Collagen is a structural protein found in many parts of the body, including tissues that support the eye and blood vessels. One kiwi can provide a useful amount of vitamin C. The exact amount depends on the size and variety. Green and golden kiwi are both good sources, although their nutrient amounts are not exactly the same. It is tempting to hear this and assume that eating kiwi will prevent cataracts or macular degeneration. The science is not that simple. Research into vitamin C and cataracts has produced mixed results. Some studies have found an association between diets rich in vitamin C and a lower risk, while other research has not shown a clear protective effect. Vitamin C has been included with several other nutrients in special supplement formulas used for certain people with age-related macular degeneration. But those formulas are not the same as eating a kiwi. They contain specific doses and are intended for people at particular stages of the disease under professional guidance. Do not buy a high-dose eye supplement simply because you heard that antioxidants are good for the eyes. If you have macular degeneration, ask your eye doctor whether an appropriate formula is suitable for you. Supplements can interact with medicines and may not be helpful for everyone. Food works differently. A kiwi gives you vitamin C as part of a whole food, along with water, fiber, potassium, and many natural plant compounds. It can help improve the variety and quality of your diet without promising a miracle. The second reason is lutein and zeaxanthin. As I mentioned earlier, these pigments are naturally present in the retina. Researchers have studied them because of their role in the macula and their antioxidant activity. The strongest evidence involving lutein and zeaxanthin does not prove that kiwi alone prevents eye disease. It tells us that these nutrients matter and that diets containing a variety of plant foods can help provide them. Think of kiwi as one member of a larger team. Spinach, kale, peas, sweet corn, eggs, and other colorful foods can provide lutein or zeaxanthin. Kiwi adds a fruit option, especially for people who struggle to eat enough vegetables. Carotenoids are absorbed better when a meal contains a little healthy fat. You could slice kiwi into plain yogurt, eat it with a small handful of nuts, or add it to breakfast beside eggs. You do not need a large amount of fat. A normal balanced meal is enough. The third reason is that kiwi may help you replace less helpful snacks. Many people reach for biscuits, sweets, pastries, or sugary drinks when they want something quick. Replacing some of those choices with whole fruit can improve the overall quality of the diet. Whole kiwi contains fiber. Fiber slows digestion and helps make a snack more satisfying. The fruit also contains water, which contributes to hydration. This matters to eye health in an indirect but important way. Diabetes and high blood pressure can damage the eyes. A balanced diet, regular activity, and a healthy weight can help you manage the conditions that place vision at risk. No fruit cancels the effects of smoking, uncontrolled diabetes, or untreated high blood pressure, but daily food choices can work together with medical care to support your health. If you have diabetes, you do not automatically need to avoid kiwi. It contains natural carbohydrate, so portion size still matters. Whole kiwi is generally a better choice than kiwi juice because the whole fruit keeps its fiber and is easier to portion. Follow the eating plan given by your healthcare professional, especially if you use insulin or medicines that can lower blood sugar. The fourth reason is convenience. Healthy foods are only useful if you actually eat them. Kiwi requires very little preparation. You can cut it in half and scoop out the inside with a spoon. You can peel it and slice it. You can also eat the skin after washing it well. The skin is edible and adds extra fiber, although some people dislike its fuzzy texture. If chewing is difficult, choose a ripe kiwi. A ripe fruit should give slightly when you press it gently. It should not feel mushy or smell fermented. You can add sliced kiwi to plain yogurt, porridge, cottage cheese, fruit salad, or a bowl of oats. Add it shortly before eating because fresh kiwi contains an enzyme that can change the texture of dairy foods if they sit together for a long time. Try not to cover it with sugar or syrup. The natural sweet and tart flavor is usually enough. If the taste is too sharp, pair it with banana, berries, or plain yogurt instead of adding refined sugar. For most people, 1 kiwi is a reasonable serving. You do not need to eat 5 or 6 at once. More is not always better, and large amounts may cause stomach discomfort or loose stools in some people. Now let us talk about who should be careful. Some people are allergic to kiwi. Symptoms may include itching or tingling in the mouth, swollen lips, hives, stomach symptoms, wheezing, or difficulty breathing. A kiwi allergy can sometimes be connected with allergies to latex, banana, or avocado because some of the proteins are similar. If kiwi has ever caused swelling, breathing trouble, or a strong allergic reaction, do not test it again by yourself. Speak with an allergy professional. Difficulty breathing, swelling of the tongue or throat, faintness, or a rapidly worsening reaction requires emergency help. People with advanced kidney disease may sometimes need to control potassium. Kiwi contains potassium, so ask your kidney team whether it fits into your individual eating plan. Do not remove healthy foods unnecessarily, but do not ignore medical restrictions that were given specifically to you. If you take regular medicines or have a complex medical condition, your pharmacist or healthcare professional can help you decide whether any major diet change is appropriate. Kiwi is useful, but it cannot do the whole job. Here is the simple eye health plate I promised. First, include dark green vegetables regularly. Spinach, kale, collard greens, and similar vegetables are among the richest food sources of lutein and zeaxanthin. If you dislike them raw, cook them gently and add them to soups, stews, eggs, beans, or rice. Second, include colorful fruits and vegetables. Oranges, berries, peppers, carrots, pumpkin, sweet potatoes, tomatoes, and kiwi provide different vitamins and plant compounds. Different colors usually mean different nutrients, so variety is more useful than eating the same food every day. Third, include protein. Fish, eggs, beans, lentils, yogurt, poultry, and other protein foods help maintain muscles and tissues. Fish, such as salmon, tuna, and sardines, also provide healthy fats. Fourth, choose healthy fats in sensible amounts. Nuts, seeds, olive oil, avocado, and oily fish can help the body absorb fat-soluble nutrients and support heart health. Fifth, choose water most of the time. Sugary drinks can make blood sugar control more difficult. Heavy alcohol use can also harm overall health and increase the risk of falls and medicine problems. This plate does not need to be perfect. Start with one change. Add a kiwi to breakfast twice this week. Put a handful of spinach into an omelet. Replace one sugary drink with water. Small changes that you can repeat are more valuable than an extreme diet that lasts 3 days. Before we continue, let us clear up 3 common mistakes people make with eye foods. The first mistake is expecting a food to improve the number on an eyeglass prescription. If your vision is blurry because you need different glasses, eating kiwi will not change the shape of your eye or replace the correct lenses. Arrange an eye test instead of waiting for a food to sharpen your sight. The second mistake is using fruit juice as if it were the same as whole fruit. Juice removes or reduces much of the fiber and makes it easy to consume several fruits very quickly. A glass of juice can contain more carbohydrate than you expect. Whole kiwi is easier to portion and usually keeps you satisfied for longer. The third mistake is buying expensive powders because their label shows a picture of an eye. A green powder may contain kiwi flavor while providing very little actual fruit. Supplements and powders also vary widely in quality and dose. Food labels can use impressive words without proving that the product prevents eye disease. Spend your money first on ordinary whole foods and recommended eye care. If an eye professional believes you need a particular supplement, ask for the exact name, dose, reason, and possible side effects. This is especially important if you take blood-thinning medicine, have kidney problems, or use several prescriptions. One more practical point is storage. Firm kiwi can ripen at room temperature. Once it becomes slightly soft, place it in the refrigerator and use it within a few days. Keeping the fruit visible can remind you to choose it before biscuits or sweets. Wash the outside before cutting so that the knife does not carry dirt from the skin into the flesh. Food is only one part of protecting your eyes after 60. The most important step is having the eye examinations recommended for you. Many eye diseases do not cause early symptoms. A dilated eye examination allows an eye professional to look at the retina and optic nerve before you notice serious vision loss. Ask how often you need an examination. The answer depends on your age, family history, medicines, diabetes, blood pressure, previous eye problems, and other risks. Protect your eyes from ultraviolet light by wearing sunglasses that block both UVA and UVB rays. A wide-brimmed hat can provide extra protection in strong sunlight. If you smoke, getting help to stop is one of the best things you can do for your eyes and the rest of your body. Smoking increases the risk of serious eye disease, including macular degeneration and cataracts. Keep diabetes and blood pressure under control. High blood sugar can damage tiny blood vessels in the retina. High blood pressure can also harm blood vessels throughout the body. Take prescribed medicines as directed and attend your health checks. Stay physically active in a way that is safe for you. Movement supports circulation, blood pressure, blood sugar, balance, and independence. Finally, do not ignore changes in your vision. Gradual blurring, difficulty reading, poor night vision, or colors appearing less bright should be discussed with an eye professional. Sudden vision loss is different. A dark curtain across your sight, sudden flashes, many new floating spots, severe eye pain, or a sudden major change in vision needs urgent medical attention. Do not wait to see whether food or supplements will fix it. So, is kiwi the #1 fruit for healthier eyes? There is no honest scientific ranking that names one fruit as #1. Kiwi is valuable because it combines vitamin C, small amounts of lutein and zeaxanthin, fiber, and other plant compounds in a simple whole food. It supports an eye-friendly diet, but it works best as part of a larger pattern. Remember the main points. Kiwi provides vitamin C, but it is not a cure for eye disease. It contains some lutein and zeaxanthin, while dark green vegetables remain richer sources. Whole kiwi can replace less nutritious snacks and support better overall eating habits. One fruit is usually enough for a serving, and it can be paired with yogurt, nuts, oats, or a balanced meal. People with kiwi allergy or special kidney restrictions should speak with a healthcare professional. And regular eye examinations remain more important than any single food. If you found this explanation helpful, subscribe for more clear and practical health videos from Dr. Adrian Mercer. Share this video with someone who wants to protect their sight as they get older. Take care of your eyes, take care of your overall health, and remember that the best results usually come from simple habits repeated over time. Thank you for watching, and I will see you in the next video.